Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP, tapos siyempre mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na, So, hindi niya na nararamdaman na minatapakan pala siya. So, probably, yun siguro yung nangyari. Minatapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After ng 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, painulets, 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titignan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. Haji Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka, kinakapa ko siya. Parang nawawala, parang wala na. Hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Healthy day, everyone. My name is Jen, a licensed pharmacist and one of your health advisors here in Simply Nature. We are an international distributor of food supplements derived from a unique strain of microalgae known as PPARS, which has been tried, tested, and certified, proven to support not only cancer treatment, but also enhance general health and reverse metabolic syndromes like hypertension, diabetes, and high cholesterol. Now, just a quick recap. Last week, Thursday, we discussed about why the gut matters. And I would also like to thank and say hi again to the supporters of our other program, Simply Nature Answers. Yesterday, we featured Doc Joy Maria Azores de Castro, a certified naturopath from Infanta, Quezon. And moving on tonight, we're diving into a crucial yet often overlooked topic, the deep connection between diabetes and cancer, and more importantly, the solutions available to help us take charge of our health. You know, when we think of diabetes and cancer, most of us seem them as two separate serious conditions. However, science tells us that these two different diseases are more closely linked than we ever imagined. Now, to uncover the reasons behind this link, first we have a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert, fresh from Taiwan. It's Mr. Shyan Lim.
Hi, Jen. Thank you for the warm introduction. Yeah, I just came back from Taiwan because I celebrated Chinese New Year in Singapore and then in Taiwan because I have friends in Taiwan as well. Anyway, it's good to be back. Yesterday, we had a very good session, episode of Simply Nature Asks and Answers, sorry.
Answers.
And I really answered one of the questions about thyroid and iodine in our products. But tonight's topic is one that's very interesting and one that is very important because in Philippines, I think many of us are diabetic or pre-diabetic, but we don't know it yet. But I think from the level of sweetness and sugar and the amount of fatty food that we eat here in the Philippines, it's not a surprise if most of us have slight or even normal levels of diabetes. So it's important to know what's the connection between diabetes and cancer. I think we are sort of not scared of diabetes, but I think we are all very scared of cancer. Well, there is actually a link between the two. So I hope that tonight it will be a session that's interesting and we'll be ready to answer your questions in the Ask Me Anything segment. So let me hand the time back to Jen, who would introduce our speaker.
Thank you, sir. Up next is Dr. Jansen Calalan, a graduate of St. Luke's College of Medicine, a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Let's all watch this.
What's amazing with PPAR gamma activation is that it promotes apoptosis. Now, TZDs do not do that. The product that stimulates cell death is microalgae, PPARS. The Simply Nature PPARS came from microalgae, which is literally food. It was made by God, not synthetic whatsoever. So there's a lot of a myriad, thousands of nutrients and polyphenols inside the microalgae that works in synergy. Okay? So when you take it, then that's when it becomes really effective, especially when you tie it up to a healthy lifestyle.
Welcome everybody to another episode of Simply Healed. And today we have Dr. Jansen with us again. Doc, welcome back to the program.
Hi, glad to be here again with you guys.
So Doc Jansen, does sugar affect cancer?
Okay, the simplest answer is yes and no.
Alright, yes and
okay,
no.
yes and no. Yes, sugar feeds cancer cells for their growth, but our healthy cells, our normal cells, also need sugar for it to function. Okay? So, where did this concept of sugar feeds cancer cells came from? So, it's because of the Warburg effect, no? So, basically, what the Warburg effect is that since cancer cells are multiplying
Growing
uninhibited, they're really growing fast, so they are highly metabolic. And the primary fuel of metabolism is glucose or sugar.
Alright.
So these cancer cells will tend to metabolize glucose much faster or at a higher degree than the normal cells. Okay, but is it really the sugar? Having diabetes doesn't necessarily always equate to cancer. So diabetes does not cause cancer, but those of you who are diabetic have an increased risk of getting cancer. Okay, so hi guys! Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. Now, Doc, we have to control our insulin, right? So how do we do that?
How do we do that?
How do we do that? So, remember, the main function of insulin is that once you eat, your blood sugar increases. The main function of insulin is to bring down your blood sugar. Okay? It's a negative feedback effect. It's in order for your body to control your blood sugar levels. Okay? So, how insulin decreases the blood sugar levels is that insulin acts like a key. So, the insulin attaches to a receptor in the surface of the cell membranes. Okay? So once that insulin attaches to that receptor, the receptor acts like a gate or a door. So it opens up so that your blood sugar can go inside the cell in order for your cells to utilize sugar or glucose. Okay? So that is the basic function of insulin is. Now, here's the problem. Insulin also attaches to a receptor in your cell membrane called the INSR receptor. So the INSR receptor is an enzyme. Okay? So once insulin interacts with INSR, this produces a cellular cascade, no? A cellular cascade that leads to increased cell proliferation, increased migration, increased differentiation, and inhibition of apoptosis or cellular death. So, in simpler terms, it produces increased cellular multiplication. And remember, cancer is unlimited cellular multiplication. Okay? Uninhibited cellular multiplication.
Wow, that's dangerous.
So, that is how it does it. So now, you have to be able to control your insulin spikes. In order to do that, you have to increase your fiber intake. Okay? Because, why? Fiber, once you eat it, inside the intestine, it acts like a sponge so that your intestine does not absorb all the sugar in one go. Okay? So that is how you control your insulin spike.
That's a problem for Filipino diet because we eat rice and adobo with no fiber in it at all because the rice is white rice, not brown rice.
Yeah.
So that's why, and my friend, I remember my friend has his record is at Mang Inasal, unlimited rice, 8 bowls of rice. So that he must have had a crazy insulin spike.
Yeah.
So if he was a cancer patient, that would be bad news.
Here's what you can do. You can actually take cleansing. So cleansing is a fiber drink.
Okay.
You can actually drink it before you eat. Okay,
Oh,
so
that'll
that
make you full.
Yeah, it will make you full. Number one, so you don't eat as much, and then you get your dose of fiber, so you get your sponge, so to speak. Okay, and then eat the food that you like. But of course, doesn't if you're taking cleansing, then you're going to eat your lechon, you're going to eat your mang inasal. Then doesn't work that way. You know. So still, you should be eating a whole food plant-based diet, and then, if you are not yet ready or you are on your journey into transitioning, then drinking cleansing would be a very good help so that you immediately up your fiber intake. Hi guys! Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A.
PPA gamma activation, like using TZD, which is a drug, to do that, will actually reduce or prevent your cells, like your cancer cells, from running around like crazy.
Yeah,
You basically calm them down so that they're not super active.
Yeah.
And that means for cancer patients, literally it means to slow down your tumor's rate of growth and to also prevent metastasis, the rampant growth. And I heard, Doc, you mentioned to me just now in our discussion, it also encourages apoptosis because INSR reduces apoptosis. So if you lessen INSR, you actually cause apoptosis to happen more frequently.
Yeah.
And for our listeners out there, when I first heard the term apoptosis, I was like, what is that? Doc, what is apoptosis?
Okay, so apoptosis is programmed cell death. Okay, so cellular death, it's just cells dying. So that's medical term, it's apoptosis. Okay, so the amazing thing is that, okay, so INSR inhibits apoptosis, so it stops cell death. Okay, so once it inhibits cell death, then that gives your cancer cells a chance to grow exponentially, to grow more.
Wow.
Now, what's amazing with PPAR gamma activation is that it promotes apoptosis. Now, here's the thing.
Wow,
TZDs do not do that. Okay? TZDs do not induce cellular apoptosis. Okay? The product that stimulates cell death is microalgae, PPARS.
Wow, our Simply Nature PPARS. In fact, I'm going to ask Junie right now to find that research and flash it in front of you. Okay, so we actually published in, I think this is in Hindawi, which is the medical, where people publish medical journals, right? Yeah, and it states there our extract actually induces apoptosis.
Yeah.
So, this is the funny thing. For all the cancer patients out there, again, just to remind you, apoptosis means that your cancer cells die by themselves.
Yeah.
All right, they are supposed to grow old and die in a way, but strangely enough, normal healthy cells grow old and die, but cancer cells live much longer because of this reduced apoptosis. Well, if you take Simply Nature PPARS, that's why Dr. Jansen, you prescribe it to your patients, because it actually encourages the cancer cells to die on their own without using chemo or anything. Is to switch on the switch that makes them grow old and die. Wow, that's amazing.
Yeah, and the beautiful thing with it is that the Simply Nature PPARS came from microalgae, which is literally food. It was made by God, so God designed it that way.
Wow.
It's not synthetic whatsoever. So there's a myriad, thousands of nutrients and the polyphenols inside the microalgae that works in synergy. Okay, so when you take it, then that's when it becomes really effective, especially when you tie it up to a healthy lifestyle. Okay.
Again, if you have any questions, please ask. We might pick up your question and do an entire program on it. So, Doc, thank you very much.
Goodbye, everyone.
Okay.
Summarize, diabetes and cancer share common pathways, but we are not powerless against them. Through proper diet, lifestyle choices, and natural interventions like PPARS protocols, we can take proactive steps toward prevention, management, and even recovery. I know you must have some questions, so type them in the comment section below. We will try to answer as many as possible because it's time for our much-awaited live AMA or Ask Me Anything portion. Now, to answer your questions, in this modern world filled with noise of different health opinions, trust the ones from the experts. Let me call back on Mr. Shyan and Dr. Jansen.
Hi, good evening, Jhen. Good evening, Doc.
Hello, good evening. Hi.
Hi.
It's nice to have you back, sir, in our AMA, because last time you weren't here, you were in Taiwan and you visited our factory.
Yes, correct. And I want to thank Dr. Jansen for covering for me. Thank you very much.
Of course, of course.
Relaxing time in Taiwan. So
Ayan,
yeah.
we'll flash some pictures. Oh, there you go.
Yeah, I was there at the pond. This is where we grow the Simply Nature PPARS. Yeah, it was raining there. That's why the floor is wet. Yeah, Taiwan was very wet this time this season. Yes.
Yun. Okay. Let's start the AMA. First question is actually coming from an unanswered question from
Okay.
yesterday's SNA
Oh.
from Facebook, Ma'am Celestine Cherry May. Hi, Doc. What is the best remedies for GERD and anxiety?
Oh wow.
Okay, let's answer GERD, no, in general, because GERD and anxiety are related. So, GERD is gastroesophageal reflux disease. So, this is just the medical term for acid reflux. Okay. So, what are the triggers for acid reflux? So, the first one is stress, which leads to, anxiety. Anxiety also leads to stress, right? So, well, if you think about it, stress is part of life. We cannot really um, stay away from it. It's like tax. So, um, we just have to manage stress. So how do you manage stress? You rest. Okay, take time away from the stressors. No, these things. Now, it would be different if the stressors would be relationships because this is your this is people skills already, relationship with other people, okay, and how you are with other people. But in general, no, for stress, you have to manage it. So you take time away from stressors, um, to allow your body to recover. Yeah. So that's one. Number two would be food. There are a lot of food that triggers hyperacidity, which triggers acid reflux. And yeah, basically GERD, no? So the number one food which can trigger acid reflux are, of course, are acidic foods. So what are acidic foods? Foods that are sour. Um, Sodas, no? Sodas are acidic in nature. Citrus fruits are also foods that are very hard to digest, like your meat, dairy products as well, spicy foods. What else? Yeah, so basically these are the more common ones. So fatty foods as well. No? I almost forgot to mention. So these food items that I have mentioned, if you find yourself having acid reflux triggers after eating these foods, then you have to stay away from them. Really, okay? If say for example, you love coffee, however, coffee triggers acid reflux, then how do you what can you do about what can you do with coffee so that the acid reflux trigger would be minimized? So what you can do is you can drink coffee after eating a big meal, okay? Or you can drink coffee with plant-based milks like your soy milk, oat milk, almond milk. Okay, so this is so the acidity of the coffee will reduce. Okay, so these are some techniques, no, that you can do. But of course, the best is to stay away from them, so the reflux doesn't get triggered. Number three reason for acid reflux would be infection, H. pylori infection. So this is a bacteria residing inside your stomach that destroys the gastric lining, which leads to ulcers. So the ulcers will trigger the reflux, the stomach pains as well. Okay, so these things are interrelated together with anxiety. So the best remedy for this is to stay away from them. If it is infection, no, best to have it treated. You have to go see your doctor, your gastroenterologist, to get diagnosed, to get and to get prescribed with antibiotics. Okay. Some supplements that you can use, no, for acid reflux. Of course, supplements that have very high anti-inflammatory properties like Simply Nature PPARS. Another one would be berries. Berries are have very high antioxidant characteristics. Yeah, so basically those foods, no, those supplements would be good. Yeah.
Thank you, Doc. Next question from Ma'am Diana. Are sweet fruits good for cancer patients?
In general, we do not want cancer patients to consume foods that are very high in sugar. However, um, fruits in general are also very nutritious. So there are certain fruits that benefits cancer patients. However, of course, there is always the concern of its high sugar content. So cancer patients, yes, it's okay to eat fruit, but only one serving per day. So one serving is half a cup or half a cup of chopped fruit, no? Or 1 cup of unchopped fruit or a piece of fruit if it doesn't fit in a cup. Yeah. So that's basically how you approach this, and always eat the fruit after meals. Okay, eat them as a dessert. Do not juice them. Okay, please do not juice them because you are removing the fiber, and fiber is very important because fiber will control the sugar spikes and the insulin spikes, which are the ones that are that we want to avoid. No, yeah.
I'm just curious, why would this particular viewer ask about eating sweet fruits, whether they are good for cancer or not? You know, is there? I'm just wondering, Doc. I mean, what do you think? Why would anyone think that eating sweet fruits is good for cancer? Maybe for energy purposes? Yeah.
Um, Energy purposes, I don't think so, but I think the person loves fruit and probably the person has
Okay.
sweet tooth.
Okay.
So that might be one reason.
I'm just
Yeah.
Just asking, just in case there is, maybe she heard it from somewhere. Yeah. So in general, right, Doc, a accurate, how shall we say, a general statement. So we will avoid things like cakes and super sweet iced lemon tea, for example. All these are actually not good for cancer patients. And
Yes, correct. Yeah.
all right. Okay. So that's it for this viewer. I know. I guess you must really love fruits, and I think the wonderful thing about Philippines is all the fruits here are sweet. I think Philippines has amazing soil. So even the pineapples and everything are so sweet naturally. So watch the amount you take, and like what Dr. Jansen said, don't juice. We always think fruit juice is good for you, but you have no idea when you're eating a sweet fruit juice, you're eating like a whole pineapple in one glass of pineapple juice. So that's too much to take at one shot. Yeah.
Thank you for that clarification. Before we move on to the next question, let me just greet one of our avid viewers, Ms. Mavs Agot. Good evening po. Okay, next question coming from Hannah. Can PPARS help with glaucoma or reverse it at the onset?
Glaucoma is an eye disease wherein the pressure inside the eyeball is elevated. So inside your eyeball, there is a fluid. Okay, so that fluid is being produced by your eye. It is also pressure inside the eyeball, no? Wherein that is the pressure that the eye tries to maintain at. So in glaucoma, what happens is the draining, the drainage of of that fluid is blocked. Hence, increase in pressure. Okay, that would lead to glaucoma actually. So the problem here is anatomic. So if the problem is anatomic, then the solution is also anatomic, which is surgery. Okay, so there's no supplement that can improve this or slow the progression, even slow the progression. There's none. You can use medications. There are medications to help open up the drainage and or help reduce the production of that fluid. Okay, yeah. So you use medication or surgery. Yeah.
Yep. So in short, PPARS doesn't help with the glaucoma. Yeah.
Okay. Okay, next question from Protasio. Is the PPARS soft gel capsule sufficient for prostate enlargement?
What's your experience?
Yeah, it can help, but of course, don't just rely on PPARS. Medications still have to be used to manage the prostate enlargement. So, how PPARS helps prostate enlargement is the reason of prostates enlarging is it can be linked to metabolic problems, no? It can also be linked to inflammation. So, since PPARS helps manage metabolic problems, then you can actually address the root cause, even the inflammation, no? If in case of prostatitis. However, it doesn't act directly on the prostate. Okay, so while addressing the root problem, you have to address the prostate itself as well. So you still have to take medications to help reduce its size. Okay, and also, of course, no, utilize other treatment methods as well, no, to help reduce its size. So, I hope you understand where PPARS comes in, no, when it comes to prostate management, no. So it addresses the root cause, not really the problem itself. Okay.
So I mean, Dr. Jansen's answer is a great insight to many of us, where we don't want to take drugs, right? But yet we are also concerned about our medical condition. So what Dr. Jansen shared is wonderful because it means that you can take both at the same time, and there is a likelihood, a strong possibility that you go off the drugs faster. You don't have to take so much drugs because you're also taking lifestyle changes and supplements to improve your body at a faster rate. So again, I shared this many years ago, especially with Dr. Jansen. I have an uncle who is actually a trained neurosurgeon, and he's also at the same time a Chinese physician. So he has passed on, but if he were alive today, he would be in his 80s. All right. So that means he was a doctor trained, not like Dr. Jansen recently. He's a doctor probably trained in the 1950s. So the difference about Chinese doctors, he's actually from China, all right? The difference between Chinese doctors then and now is this. In the early days, when China was just opening up, so they have neurosurgeons trained in Western methods and in the West. However, they have a double requirement. That means they must be fully trained in TCM, acupuncture, herbology, and everything, and at the same time, Western medicine. So I did ask my uncle once before, since he's equally trained, and he's very highly trained as a conventional Western doctor because he's a neurosurgeon. So you can imagine that's already one of the toughest and most difficult, right? And at the same time, he was a Chinese medicine researcher. So he was pretty gifted medically. So I did ask him this question. How would he reconcile, or how would he use both East and Western medicine? So his answer to me, maybe because this is why he's a surgeon, he said Western medicine's greatest contribution to medicine is surgery. Because other traditions like Ayurvedic, which is the Indian, the Chinese, they don't do surgery. It is the Western medicine that actually does surgery. And he said another thing. He said drugs work, and drugs work very quickly and very consistently. He said the weakness in Western medicine is that Western medicine doesn't treat the root symptom, the root cause. It doesn't treat the causes. It usually treats straight away and very effectively the symptoms. So he shared that the best use is to use Western medicine to arrest or to stop your disease from getting worse, to stabilize it, so that you have time and your body is in a more stable condition. Then you can start to treat the root cause. So when Dr. Jansen shared just now, going on drugs and natural approaches like Simply Nature PPARS, you're actually adopting this approach my uncle was talking about, using the best of natural and convention. The drugs will be able to give you immediate results to buy you time and stabilize your condition so that you don't get worse, right? Then you use the natural to get rid of the root cause. I think this combination will give you fantastic results, which is why Dr. Jansen is also one of the foremost integrative doctors in the area of, especially in the area of treating cancer patients. Right. Right, Doc. I mean, I think that's the best combination, lah. You know, people always want to choose either east or west. It's like saying, you know, you see 500 peso on the ground and 1,000. Which one do you pick? The answer is both lang. Take the best. Take both, right? Yeah. Okay, Jen, let's continue.
For those of you who wish to have a consult with Dr. Jansen Kalalan, the link to schedule an appointment is in the description. Miss Beth and Miss Irish will reach out to you shortly. And our next question is drawn to us privately. What PPARS can help with migraine?
Good question. If the migraine is really, really bad, try the soft gel. Now it's a matter of how many soft gels you'd be taking in a day. Start with one. We'll start with one. Yeah, if one would do its job, then good. But if not, then increase the dose up to 3 soft gels per day. So see if it works. If it still doesn't work, come see me.
Yeah, Doc, I also want to give you I mean, this patient asked, and just nice, yesterday I was speaking to one of Jen's clients who is actually my property manager in my condominium that I live. So good news, Jen, your client actually, she lost a lot of weight. And I asked her what is the benefit that you appreciate most. So she's on just tablets and cleansing plus. She said her migraines disappeared. So I was like, okay, how often did you have migraine? She said once every 2 days. But she said after taking the product for about a month now, right, Jen?
Yes, yes.
She said none at all, zero. So I have no idea what's the root cause of a migraine. Doc, correct me if I'm wrong, but migraine can have many, many reasons. It's quite hard to pin down your cause of migraine. Sometimes even constipation causes migraine, diba? If a patient is constipated, the toxins build up and they get frequent migraines.
Yeah. Migraines is a type of headache wherein it is rooted to inflammation. Yeah, so it's rooted to inflammation. Now,
so constipation creates inflammation? I mean,
well, constipation has something to do with your gut microbiota and the food that you're eating.
Okay.
So if you're on a bad diet, guess what? Inflammation is gonna be very high inside your body. So that can also lead to migraine. So migraine is just a manifestation of a problem. So it's similar to constipation. So if you eat very low fiber meals, eat a lot of meat, junk food every day, guess what? You're gonna be constipated. If you are not constipated, you develop migraines from that, then that is a consequence of the bad diet that you're eating. So it has something to do with the gut microbiota composition. That's why when you gave the patient cleansing plus, the symptom improved. Because cleansing plus is made from psyllium husk. Psyllium husk is a fiber supplement. It's also a prebiotic. There are a lot of studies actually on psyllium husk and the gut microbiota, not just with migraines but also with allergic manifestations like atopic dermatitis, allergic rhinitis, asthma. So there are a lot of studies showing that it changes the gut microbiota composition to a better better variety. Yeah.
Wow. Okay. There you go, migraine.
Okay.
Going to the CR every day is a solution to your migraine. Okay, so yeah, if you have migraine and you're also constipated or not regular, then there you have it. This is one of the probable reasons why you have migraine, and it's easier to solve. Yeah.
A quick shout out again for one of our avid viewers, Helen Basalo Kamunayan from Baguio. Okay, next question coming from Joresa. Can PPARS help with Alzheimer's prevention?
Oh, that's an interesting one.
Yeah. It can.
Doc, please share the science. Yeah, it's very interesting.
Alzheimer's is a condition wherein inside your brain there are neurofibrillary tangles and plaques that form. So these are proteins actually. So medical, but just understand that they're proteins that accumulates inside the brain. So how does this? Why does these proteins accumulate inside the brain? It's because of constant fluid inflammation. That's one. Another one is insulin resistance. Okay. That's why Alzheimer's is actually being touted as a form of diabetes. Okay, but it's unique inside the brain. There is another one which is because of toxicities, heavy metals, etc. Okay, endocrine disruptors. So these things. Now, over time, this will accumulate inside the brain. Okay, and when this accumulates, the manifestation is dementia. So dementia is memory loss. Basically memory loss. Okay. How does this lead to memory loss? It's because the inside your brain also these nerves conduct electricity, and the proteins increase the resistance of the electricity going around your brain. So the signal would be slower. Some signals would be lost. That's why you have the manifestation is dementia. Okay. So using PPARS, PPARS is a microalgae supplement. So it is a chelator. It detoxifies your body. Since it's microalgae, it has very high antioxidant properties, so it can address the chronic low-grade inflammation. Studies have also shown that it can improve insulin resistance. So it's a solution actually. It's a good supplement to take for the prevention of Alzheimer's. But of course, you have to do your job as well in terms of your lifestyle. Because if your lifestyle is really bad, and you just take these things, during the short term, yes, it can help mitigate. But over time, the will tend to accumulate the bad effects that happens to your body. Okay, so make sure you also do your part when it comes to your lifestyle. So how do you change your lifestyle, prevent Alzheimer's? Basically the same for every other chronic disease. Eat well, eat a high fiber foods that are high in fiber. So basically plant foods, you exercise, you sleep. Okay? Sleep, I need to emphasize this because if you lack sleep, the risk for developing Alzheimer's disease later on in life also increases very, very much. It's actually the lack of sleep that increases Alzheimer's disease the most.
Oh
because
no!
during during sleep,
Oh no!
during sleep, your brain detoxifies itself through your lymphatic system.
Oh no! Okay, you have
Okay? Yeah.
scared me enough. I'm gonna sleep early tonight. Doc Jansen, he cares about me. He's always been telling me because I sleep about 4.5 to 5.5 hours a day. He says that's too little, and it's one of the reasons why I get my blood pressure is a little high. But sorry, Doc, you hit this one scares me more than anything. Okay. Jhen.
Okay, should we fast forward to the last question, sir?
Yeah, but I tell you, tell everybody I'm gonna sleep early from now on. Don't bother me with emails or anything.
Okay.
Thank you.
Before we move on, let me just greet one of our avid viewers. They're very supportive. Ma'am Naomi Alona Veras from Marikina City. Okay, how is there po? Is it raining? Okay. This question is coming from Renzo. What causes aneurysm and can PPARS help?
Aneurysm.
Most of our
okay.
questions, they are inside the brain.
Yeah. Yes, PPARS can also help, no? But it is wow. Aneurysm, you don't want to have aneurysms happening inside your body in the first place. So the best way to address aneurysms is to prevent it from happening in the first place. Because once you have aneurysms, that's a ticking time bomb. Okay, so what are aneurysms? Aneurysms are basically ballooning of your blood vessels, especially arteries. Arteries, what specific arteries? No, arteries that bifurcates. So arteries that from one vessel it divides into two. There are a lot of blood or arteries that inside the body that has these characteristics, especially inside your brain. Okay. Not only your brain, but also the biggest artery inside your body, which is the aorta. Okay, so how does aneurysms occur or happen? Hypertension, especially uncontrolled hypertension. Number two, if the elasticity or the quality of your artery goes down. How does it go down? Inflammation, number one. Number two, lack of vitamin C, lack of collagen production, genetic problems, no? Like Marfan's disease. The genetic problem, we cannot really do something about it currently. We still cannot do anything about it because it's genetic. The solution to that is genetic therapy, which we still don't have nowadays. But probably, I think in 20, 30 years, probably we can have such already. Now, going back, say for example, it's not related to genetics, it's related to lifestyle. So, number one thing you have to address is hypertension. So, with hypertension, we still go back to your lifestyle, food that you're eating, exercise, whether or not you're overweight or not, sleep as well, whether or not you have vices, smoking, including vaping, alcoholic beverage drinking. So these things have to be taken into consideration. So yeah, very important to make sure that your blood pressure is managed, is controlled, or else you risk developing aneurysms, and the aneurysms can explode. Okay, so signs and symptoms of aneurysm: frequent headaches, throbbing headaches. Okay, in case wherein you have a blood vessel inside your brain ruptured, that would be the worst headache. Description that we medical practitioners describe that headache is a thunderclap headache. Okay, if you feel that, you have to immediately go to the ER. Okay, go to the ER immediately because you can die from that. Bleed inside your brain. Okay, you can die from that. Here in the Philippines, since we are a tropical country and Filipinos really love salty foods, it is the hemorrhagic stroke type that is more common compared to the ischemic stroke type. Ischemic stroke is more common in the Western world. Yeah, so here in the Philippines, it's hemorrhagic stroke that is more common. Well, at least that was what we were taught, no? When I was still in med school. I just don't know now. So I haven't. The data won't change so much. I think it would still be hemorrhagic stroke, no? So again, hypertension. Make sure that it is controlled. Okay. Yeah.
All right. And good thing is, PPARS can help
Yeah,
with the
PPARS
hypertension.
yeah, it can help with hypertension, especially when it comes to managing inflammation.
Yeah, and
Beautiful.
for those of you, for those who actually have an aneurysm, I just want to share with you, because one of my good friends in Singapore, he's the owner of a spa chain. I've told this story before. He had a stroke, right? And he had a stroke, not due to lifestyle. Okay, it is lifestyle in a way, but it's not because he has a bad diet. He's actually a pure vegetarian. Many Indians are. Okay, he had a stroke because his company was experiencing a hostile takeover. So it was really stress related. But he became paralyzed on half of his body, and the lower half of his body. So it's like 3/4 of him is or 2/3 of him is paralyzed. So because of that, I definitely looked into how PPARS can help with a stroke patient. So there are actually quite a lot of medical journals written up about how PPARS can help with neuroplasticity. So that means, especially if taken like within a few hours and immediately after the stroke, the next few days, it seems to be able to help the brain to quickly rewire and also reduce the damage caused by a stroke, which is similar to, which is like an aneurysm, right? So this is something that, again, when you're something so serious, definitely medical attention at a hospital is your first thing. But then, of course, immediately what you will want to think about is what else can you do that is safe, that is natural, that to help the body recover, right? It's like It's like going to hospital and then you ask yourself what is a good diet to eat while you're recovering in the hospital. It's a simple approach as that. Then here I would really like to share with you that it was really effective personally for my friend. He was able to walk within a year. The doctor actually said it was not possible for him to walk properly, but he did. So even the doctor was very surprised by both the speed and the extent of his recovery. He later went on to write a book, inspirational book about how to recover from stroke. Right, he started a foundation for stroke victims. Today, good news is he walks, but with the help of a cane. And his speech and everything is back to, I would say, 85%. Not 100%, but it was a huge improvement and much better than what the doctor said he could have achieved. Yeah, so I hope that encourages any viewers out there.
Oh, I would like to acknowledge the presence of Ma'am Janet from Child House. Good evening po. Okay, next question from Ma'am Siti Norain Haji Abdulaziz. I hope I pronounced it correctly. Okay, translated to, I have a cervical spine tumor. It's hard for me to walk, and also there's back pain. Is there any physical therapy I could do? I'm already taking PPARS powder for 3 months.
I also have the same question.
Okay.
The answer is I don't really know if there are of any physical therapy methods that might help. The best person to ask this is your rehab med doctor or a physical therapist, or probably someone who is very well versed in acupuncture. Yeah. So these are the specialists that you can ask. Okay. Yeah.
I want to share that acupuncture is really very good for like rehabilitation of nerves, right? So yeah, if you watch The Matrix, that's how they got what's his name? Keanu Reeves. You know, the whole body full of needles. But it is not unfounded, okay? And actually, it's very interesting. Acupuncture, I remember, came into prominence in the Western world when they were first demonstrated. They made the deaf hear and the dumb be able to speak, right? By triggering the acupuncture points. So it was very interesting because as long as there is nerve damage, it goes very well with physiotherapy. Right, it goes very well together. I just give an example. I have a friend. I actually took a TCM course like Dr. Jansen. We both didn't finish because it was very heavy commitment. A lot of memorization, especially the points. Right. My friend has a perpetual lower back pain because he drives about 6 hours a day. He lives in a province that they drive a lot. So over the years, he's developed this lower back pain. So during one of our class, he volunteered to be the guinea pig, right? So inserted the needle, 4-inch deep. Okay, 4-inch deep into his buttock area, right? Near the top, near the hip. And then because when you want to go 4-inch deep, the normal one needle is too flimsy, right? It's very thin. So the lecturer put 2 needles together in order to push it 4-inch deep. Okay, and then she twisted it literally almost instantaneously, because I interviewed him after that, almost instantaneously, the relief of the pain. And of course, they leave the needle in there for about 30 to 45 minutes. It takes about that long to make one cycle of the flow, the electrical flow, right? So he actually got better, right, from the acupuncture. So just to share with you, and one of our students, fellow students in the class, is actually a doctor, like your friend Doc. He is occupational, physio, no, sorry. You have a friend that is a physiotherapy specialist, but it's a doctor level. What do you call that?
Rehabilitation medicine. Yes,
yes,
rehabilitation medicine.
This Dr. Jhen, and Dr. Jhen actually has his own like little hospital, right? His wife is also a specialist, and he's a rehabilitation specialist. So he actually shared why he wanted to study acupuncture, and it works amazing. So for example, frozen shoulder, right? So for a frozen shoulder, you have to manipulate the shoulder. So in acupuncture, you can actually pierce the leg, and it actually affects the opposite side, the shoulder area. So he can do 2 treatments at one shot. And he said, and I remember during class I was asking him, he said, yeah, the moment the lecturer teaching class, the next day he's practicing on a patient, right? So I said, how is it? He said, yeah, it works. It's instantaneous pain relief. Like instantaneous. It's not like you poke it and then for 5 minutes later, then the pain. No, it's instantaneous. And then he was just sharing his experience. So for this particular viewer, I just would like you to encourage you. Acupuncture is really effective for rehabilitation, especially if there was nerve damage. And it really helps with pain and everything else along those lines as well. All right, so you please explore that. And yeah, Simply Nature PPARS can help with the aneurysm in the first place. Okay.
Yeah. And by the way, no, another advice, since you have a spinal cord tumor, don't give up too easily if the acupuncture doesn't seem to work during the immediately.
Yes,
yeah, you have to try again, because this is a cervical spine tumor, which is resides at at your spine, in your spinal cord. Okay, so a few sessions, you might need a few more sessions, a little bit more compared to other people. So keep it up, stay on it.
Yep. Yeah. As Dr. Jansen said, my fellow classmate Dr. Chan shares about the instantaneous. But in general, acupuncture, like for example, for non-pain, for pain is quite instantaneous, but for recovery of the muscle or that area, it takes definitely more than one session. All right, so it will take at least, if I'm not wrong, at least 3 or 4 sessions for you to see something. All right, to see something. And sometimes, again, as Dr. Jansen says, it takes time. But if it's because of pain, the relief is actually quite fast. But it doesn't mean that your condition reverses. But the pain part is pretty quick, which is why acupuncture is actually used for anesthesia as well. Although doc is very scary to just not to have anesthesia and just have needles while you're being operated on. Yeah, but that's actually an option. People use acupuncture instead of general anesthesia. Yeah, that's just a whole new level. All right, Jen. Interesting topic. Thank you for asking this question.
Well, we're almost at the end of the webinar. This will be our last 3 questions for tonight. Next is from Dana. For patients done with a 5-year remission, congratulations. How often should they do the monitoring such as CT scans? Case is a late-stage sarcoma.
Oh, actually, the moment that you went into remission, you should have been undergoing regular monitoring. But during this point, wherein you are already in remission for at least 5 years, I would continue to monitor once a year. Just once a year would be enough. Just so that we continue to be vigilant when it comes to, monitoring recurrence.
And this is curiosity, no? Can we still take PPARS on the day of the CT scan?
Yeah, of course. I believe the PPARS would actually even help protect your body from the harmful effects of the radiation, but it won't have any effect on the quality of the image that the CT scan gets. Yeah.
Okay. Thank you for the clarification, Doc. Okay. Next question from Facebook. Bea Arcega alias. Hi, Doc. I just started PPARS Vial and book consultation with you next week.
All right.
We can discuss how PPARS can help with pustular psoriasis.
Yeah, okay. So pustular psoriasis is a bad psoriasis. Okay. Psoriasis manifests in a lot of ways, but it's usually on the skin. It can also affect your joints. Psoriasis can also lead to sepsis. Um, One such manifestation of psoriasis, I mentioned, it's mainly on the skin, is pustular psoriasis. So pustular psoriasis is when your skin develops pustules. So in other words, small boils, pimple-like boils. So pimple-like lesions on your skin, so, brought about by the psoriasis. So this is a bad case of psoriasis, in other words. So with psoriasis, the main reason why we see the complications is inflammation as well, because psoriasis is an autoimmune disease. So your immune system is what it is. Okay, so when the immune system attacks something, it releases cytokines, inflammatory cytokines. So inflammation again. So you need strong antioxidants to manage the inflammation and to help modulate your immune system. So this is how PPARS can help patients with not just psoriasis, no, but autoimmune disease in general. So since you booked, I'll be seeing you next week. Another treatment that I use for autoimmune disease is vitamin D3 therapy. So in India and South America, they call this the Coimbra protocol. So Coimbra is a doctor in South America. Okay, he is a neurologist who was taking care of multiple sclerosis patients. Multiple sclerosis is also an autoimmune disease wherein
Yes.
the immune system
It's
attacks the
attacking.
spine, yeah, attacks
Wow.
the central nervous system. So same disease process, different organ. Okay, he used vitamin D3 to help manage the or tone down the immune system. So eventually the symptoms disappeared. And this is without the use of steroids. So I believe if you have pustular psoriasis, you'd be on steroids already. Probably methylprednisone. Okay. So the goal here is for the steroids for the steroid use to go down. Eventually wean you off the steroids. Okay. So it is a very challenging condition to have. It affects different aspects of your health, well-being as well, not just physical but also mentally and emotionally. I believe Jhen can relate so much to you because yeah, she
I was
also has
confined for 10 days because of the pustular psoriasis.
yes.
Yes.
So yeah, that's how we approach pustular psoriasis, and hopefully we achieve improvement as soon as we can. No? But this is a very frustrating disease or condition to have. So patience is a must. Okay.
Yeah. Just an update. I don't use steroids anymore. Yeah.
Congratulations.
Yes, po. And I still, yes, sir.
Can I show your photo? I don't know. No, this one is the nice one. Remember we had a company photo?
Okay.
Yeah, that one can, right? That one.
Sure.
Wait,
Because I'm
wait,
so much better now.
yeah, because I'm going to show a photo and everybody will be very shocked, I tell you. Okay, I'm going to show this photo, right? Okay, Jhen, I think you might.
Go, sir.
Okay, yeah. Here. Can y'all see? Can y'all see this person behind me?
Doesn't even look like me.
Yeah, that's Jhen. That was after were you still on medication then here?
Yes, sir. I had to taper off the prednisone.
Yeah.
Every week you reduce a milligram.
Yeah, you see how beautiful she is today. And wow, I mean, this is the reason why I'm sure this is the reason why Dr. Jansen is in integrative medicine, and why we are doing this. Again, obviously when Jhen had her condition, conventional medicine was necessary to help her. But we can also see that there are effects that you need to manage when you're doing conventional medicine, and that you want to help a patient come back to their old self, like the Jhen you see on screen today. Okay, just for your information, that was just last year. All right, so that was like 10 years ago or something like that. It was just last year. So I hope that picture, and what's more important, the real Jhen you see right in front of you right now on your screen live. All right, I hope it's such an encouragement to the viewers out there that in just a short amount of time, how much improvement you can actually achieve when you make that lifestyle change, when you take the right supplements, and you have different approaches. Doc, I actually want to interview you right now because as a medical doctor, Doc, you graduated from St. Luke's medical school, one of the best in the Philippines. You were one of the top cadre entering the med school, and then you were ready to become an oncologist, which is why you know chemotherapy and oncological protocols so well, because you're already preparing to be a specialist. And then now you talk about a protocol from South America. I want to ask one question is, just one only, because this could be a very long interview if I did it fully. One only. You have all the medical background, right? You have all the medical background. You understand all the science, and you were very in-depth. I mean, oncology is one of the more, it's a deep specialization. So as you now review interesting non-traditional approaches to treating illness, do they also still make sense? Is there science behind it, or is it hocus pocus, alaberos, witch doctors? Is there actually science behind all these new approaches, these non-conventional approaches? Yeah, just wanted your comment about that.
Yeah. Of course,
Wait,
there is
one last
science.
comment.
Yeah.
Dr.
Okay,
Jansen
okay.
is very scientific. He actually studied physics also. Okay, so he's quite a science nerd. Okay, so he's very logical, very scientific. All right, Doc. Yeah.
Yeah. So my worldview have changed though when I was younger and current how I am now. So yes, I am a very scientific guy. I approach things logically, scientifically. However, science is not just having researches, medical journals, papers, studies to back what happens to the patients, because science is also based on observations, testing hypotheses, trying to replicate things that can be replicated consistently. Okay, so for me that is science. So one thing which I observed though in the medical field is that, especially in the field of conventional medicine, especially young doctors like me, is they are too focused on researches, medical journals that will back up what they want to give the patient, or to say that this treatment is effective for one disease or the other. This, although yes, if you do this, you would have a big impact on the patient. Treatment would be consistently effective. You would have a very good decision making process in selecting therapies or medications. However, the limitation of that is you cannot innovate. You are trapped in the rigidness of the available research, the available data that we have now. So in medicine started as an art. It is a science. It is also an art. Art in the sense that you have to have some degree of innovative capabilities. You have to have some courage on doing things that might be effective for the patient. But of course, you cannot be irresponsible about it, because the first tenet in medicine is to do no harm. Okay? So with this, it doesn't mean that you can do something. You have to do it. Okay? there are a lot of conventional doctors as well who are guilty of this. Okay, so such example would be prescribing antibiotics left and right. There are doctors who do this. There are also some doctors who are quite have a lot of reservations about it. Okay, so I think my worldview now compared to when I started out, being a younger doctor, is I am more open to different treatment modalities that might be effective. So if when I am learning or when I am being introduced with one treatment, number one that I look at is if it gives consistent results. So if it gives consistent results, even if there are no medical journals backing it up, I would believe that it works. One example, PCM, traditional Chinese medicine, have been here for longer than Western medicine is. But why did traditional Chinese medicine have stayed for a very, very long time? It's because it produces consistent results. If it isn't consistent, in a millennia, it will disappear. Not even a millennia. I mean, just give it a few years, it will disappear. Just take a look at the treatments during the dark ages. Just Google, ask AI, ask ChatGPT about it, you'll know. Okay? So right now I am more open to different kinds of treatments, but of course, no, we still need science to explain why these things happen, how it happens, so that we understand the consequences, we understand safety, we make sure the patient is not harmed. If the patient will be harmed in the process of the treatment, we also know how to mitigate the side effects, the harms. Okay, so this is my worldview now. So that's how it is. That's how I am now.
Yeah, so everybody, you heard it, right? So it's not here on Simply Healed program. Our approach is not taking folk tale or fairy tales, right? We are sharing things that can be understood medically, right? Even though they are not conventional medicine, and even though some conventional doctors will argue against it, the truth is many of them don't really have a case. They're just saying it because they're making a general statement. But the procedures and the things that we talk about here are all have their medical foundations. That means we understand how it works. It's not folklore. We understand, and it's up for a robust discussion, and we keep ourselves updated. So don't be surprised if we say something here and then 6 months later or 1 year later, there are some new developments into it, right? Rather than sticking to our guns, right, and say whatever we say we will never change, that's very irresponsible, because technology changes, understanding changes. So we should always be ready. Me and Dr. Jansen, we are both always ready to change our views if it's for the good of the patient, right? If it means that we were wrong before and now there's a better solution. Okay, let me be careful. I don't think we are often wrong. Actually, I can't remember that we are wrong. Okay, it's just that we now find even better methods than we thought. We might have said this was the best thing to eat a year ago. Then now we realize that's the second best thing to eat. We found something even better. All right, that's the time that I think in my 4 years with Dr. Jansen, we've not been wrong on anything, but we have had our opinions change. That means we thought that this was the best, then we found out, wow, there's something else even better. But the one that we recommended before is still very good, huh? It's not that we were ever wrong. It's just that now we were updated. There are other alternatives. So I hope this honesty from us will also give you confidence that you can always ask interesting questions, and we welcome them. We look forward to learning from you guys as well. Thank you.
Yeah. Okay. Last two questions from Facebook. Ma'am Rosalyn Season. Hi, Doc. Is thyroid parenchymal disease cure PPARS?
Okay, thyroid parenchymal disease is a general term or an umbrella term, no, where it just says that the thyroid is diseased. Okay, there's something wrong with the thyroid. So just to answer the question, no, PPARS and thyroid diseases, they usually, from what I observe with my patients, PPARS is really quite good for thyroid problems, especially thyroid cysts, nodules, thyroid
Wow.
masses. Yeah. I actually have more patients who have thyroid mass goiter cysts, no, than patients who have thyroid function problems. So
Okay.
yeah, so if your thyroid, no, upon further investigation you have one of these diseases, then yeah, papers can help. You don't have to be afraid of the iodine content of PPARs because the algae, although algae have iodine, the iodine content of algae are quite low. Okay. Since it's a whole food, it's a natural food supplement. It hasn't it wasn't altered in any way. Okay, so it's safe to take even if you have hyperthyroidism, if you have hypothyroidism, autoimmune thyroid problems, it's okay to take PPARs. So it's just a matter of dosing and what other treatments or supplements should we utilize aside from PPARs. Okay.
Doc, I wanted to update you. This question was asked, I believe, last week, and then I answered it yesterday. So one thing is that just straight answer, our extracts, soft gel capsule, powder, and liquid have no iodine in them. All right. Our tablets actually has I think you can say trace or negligible. So actually I told in yesterday's Simply Nature Answers that we should really amend the nutritional profile that we send out to our clients because there is iodine. We should really put just trace amounts. Okay, I gave an explanation yesterday. Okay, iodine is often predominantly, let me use the word predominantly, found in sea plants that are aquatic plants that are from the ocean. All right, fresh water aquatic plants don't contain iodine. You actually need seawater or oceanic aquatic plants that will contain iodine. So seaweed contains iodine. All right, and they can be considered a good source of iodine. However, algae like chlorella, spirulina, and our Simply Nature PPAR tablets, algae, microalgae, these are fresh water algae. Okay, so because they are freshwater algae, they usually don't contain any iodine at all, okay, or very trace. So you got to remember, plants get their nutritional content from the water that they are grown in, right? So that's why you want to use natural mineral water, I mean natural water from the springs to grow your algae. Why? Because they are higher in mineral content. Then the algae will absorb the mineral, the plant will get the minerals from the water. So because these are freshwater algae, they don't contain iodine. But if you get seaweed, they are grown in the ocean, all right? And probably the plantations or the nurseries that grow seaweed for commercial purposes are probably like your fisheries. That means they actually allow seawater to come in and they're not freshwater seaweed. Okay, so that's for those who are interested. So if you're looking for iodine content, for example, you live in Baguio and then your food doesn't contain iodine, I'm sorry to say that Simply Nature PPAR tablets won't be your source of iodine. Okay, however, it's very effective for goiters and all that. Yeah. Okay, so we answered it conclusively. The iodine question. So chlorella, spirulina, all these are all freshwater algae, and that's the reason why they contain very little or no iodine at all. Okay, Jhen.
Last greeting before our last question. Good evening po to Demetria Buhay from Tagum City. Okay, last question. This is thrown privately. My breast cancer seems to be improving as my breast used to look so red. But after
Wow.
taking PPARS, redness subsided, but
Wow.
skin seems still to be a little dry. Also, there's pain in the lumbar part. I'm on PPARS powder, 2 scoops 2 times a day. Oh, but she didn't say what stage.
Okay. But it's
Mm,
big news. Mm.
yeah, so what's the question?
Yeah, what's the question? I was like, I thought
Okay.
it's just good news.
Well, there's already improvement, right? That the skin redness is subsided. Okay, but skin still seems to be a little dry. So should she just continue the 2 scoops 2 times a day, or any other recommendations about the dryness?
Okay, don't worry too much about the dryness. What's important is the tumor goes away. Okay,
Yeah.
if 2 scoops twice a day works for you, then good. But for my other patients, no, what I recommend is 5 scoops twice a day. If it works for you, at 2 scoops, then it's fine. No, you can continue taking that. Yeah.
Okay. I
No,
think
okay.
we've covered all our questions.
Yeah.
Yeah,
Wow,
so
long session
okay.
today. Almost an hour.
Shout out na
Hour
lang to
plus.
our viewers who came last minute, Ma'am Minda Vanilla and Raquel Gold. Okay, so you still witnessed the final words as we wrap up this evening. We'd love to hear your final thoughts, Sir
Doc
Shyan and
first.
Doc
Yeah.
Jansen, for our viewers.
Yeah. So thank you everyone though for staying with us until this late at night.
Yeah.
Just know this that whatever we recommend now can change in the future as developments in medicine comes up now, as there are new updates. So there might be things that we say now, or at least me, no, that I say now that might not be, that I might change in the future. Okay, so always, so with this, no, if you want to stay updated, watch every single week. Okay, every single week, yeah, because you never know that there might be some new things that I would mention, especially as I am very much active as well when it comes to medical conferences, attending workshops, especially uh, things, no, or educational opportunities that might help cancer patients. So yeah. Also, I just want to let all of you know there is an ongoing, or not ongoing, no, I should say that it is just brewing. There's a partnership between me and IPI, the management of IPI. IPI is a very big company in Cebu. They're planning to build an integrative medicine clinic, a traditional and complementary clinic. So we haven't decided on the name yet, but just know that this involves integrative medicine and TCM.
Wow.
Acupuncture, I believe, will be there as well. They have acupuncturists already on board.
This will be in Cebu? This will be in Cebu?
Yes, this would be in Cebu, and I would be helping to build this clinic.
Does this
So
mean that you will stay in Cebu?
No.
Okay.
Just be a consultant, yeah.
Okay.
Just to guide them on how, to build the clinic. So this is a very good opportunity for those of you who are in Cebu. I also have patients in Cebu, so this might be a clinic wherein you can go for treatment. Okay, so stay tuned, no? So I'll give you further updates as developments come by. I'll share with you during our Thursday webinars. So yeah, stay tuned, no? See you next week.
Yeah, so congratulations, Doc. And I love this thing that's happening in the Philippines. They're actually, you said that there's a traditional clinic, so you mean conventional medicine?
No, it's a mix. It's integrative. So it's a mix of conventional and complementary, alternative complementary medicine, traditional Chinese medicine, because the clinic is inside the hospital.
Oh, wonderful. So to all our viewers, right, I think this is exactly what you've been waiting for all the years, right? That the two choices are beginning to come together, right? So it only means, haha, we've been right all along, Doc. we've been right all along. So to all the viewers who have followed us for almost four plus years, you know, what we said is now being accepted in the traditional hospitals is going in. So
Yes, can you believe, sir, it's our 199th episode today.
wow, so next week is the big 200.
200,
Wow,
yeah.
okay. 200 is 4 years plus, all right? 4 years, 1 month. Oh my God. So we've crossed the 4-year mark already. Wow, wonderful. So my parting words is thank you guys, and thank you for your interest in medical science beyond conventional medicine. As what Dr. Jansen has shared, you can see hospitals now having integrative clinics in it, and I believe over the years, the things that you have been looking for and that you already understand. So you are actually ahead of many doctors. You're actually on the forefront of understanding. And again, to give everyone confidence that we here on our program, we approach everything from medical understanding, right? And thank you for the viewers who shared your success story live on the chat beside us. And I hope that encourages the other guest viewers who may be here the first time. I hope you have found the right channel for you where you can ask questions and also see the success of other people, and you can learn what they did to get back their health, and wishing you success on your journey as well. All right, so see you again next week, everyone.
Thank you so much to our experts, Mr. Shyan and Dr. Jansen, for sharing their expertise and insights. And to our clients and patients, remember, knowledge is only powerful when applied. So let's take action toward a healthier future starting today. And if you found today's webinar valuable, don't forget to like, share, and subscribe so we can continue spreading valuable health insights. Also, check out our website. That's www.simplynature.asia for exclusive promos, such as get more than 280 pesos off when you buy either PPARS powder extract or PPARS liquid extract. There's also a get one free bottle of PPARS tablet when you buy either PPARS powder or PPARS liquid. And lastly, get 1 pack of soft gel capsules when you buy 6 packs. There, ayan, the posters are flashed on your screen right now. We hope to see you again in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. Next week will be the 200th episode, February 27. We'll talk about, sorry. Okay, there. Okay, it's flashed on your screen right now. And thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we're always with you from start to healing.